Good morning, students. Today I am going to talk about the drug dosing. So, what is a dose? Dose is the amount of the drug which is required in either weight, volume, or moles or international unit to, to produce a desired effect. In clinical terms, it is the therapeutic dose which we use to produce the response. And for all the experimental purpose, we use the term effective dose, which is required to produce the effect in the animals. Therapeutic dose varies from person to person. No two persons are alike, and for every individual has his or her own peculiarities. Based on that, the therapeutic drug may vary from person to person. Dose also varies in the response with the amount which we are going to give. Classical example is that of aspirin, which is an analgesic anti-inflammatory drug. When it is given in a dose of zero point 0.3 to zero point 0.6 gram, it produces analgesic effect, and it is used in case of headache. But for producing the anti-platelet effect, we have to give it in the dose of 60 to 150 milligram per day. And to produce the anti-inflammatory effect for patients of rheumatoid arthritis, the dose of aspirin is 3 to 5 gram per day. So the different amount of the dose also plays an important role to produce different effect. So coming to the measurement of the drug effect, so when we take a drug orally, so there is a lag period during which the plasma concentration of the drug goes on increasing till a time reaches when the onset of the action starts, and it peaks with the plasma concentration to reach when the maximum plasma concentration is there, the maximum effect of the drug is there, and with the metabolism and excretion, the effect, the plasma concentration decreases, and the action effect of the drug also decreases. Coming to the drugs which are given as a single dose, like piperazine, is sufficient to eradicate the roundworms, or single intramuscular dose of 250 milligram of ceftriaxone is used for the treatment of gonorrhea. Then there are drugs which are given in a daily dose. So the daily dose, it is the quantity of a drug to be administered in 24 hours, all at once or in equal divided dose. This depends on the T half of the drug. Like erythromycin, 1 gram per day is to be given in 4 equally divided doses. That means 250 milligram is to administered in every 6 hours. So make sure to take the drug every day, otherwise the effect wears off. So if we are taking a drug, so based on the frequency we have to take, otherwise the effect goes. So total dose is the maximum amount of the drug that has to be administered or needed to complete the course of the therapy. For example, procaine penicillin, the total dose for early syphilis is 6 million units. So we have to give zero point 0.6 million unit per day for 10 days to complete the total dosing. Loading dose, it is the large dose of a drug to be given initially to provide the effective plasma concentration rapidly. And the drugs having very high volume of distribution, we have to give the drug in the loading dose so as to completely reach the equal concentration in all the compartments of the body. Classical example, that is chloroquine in malaria. The loading dose is 600 milligram stat given, and then after 8 hours we have to give 300 milligram and 300 milligrams for the next 2 days. So these 300 milligram, that is the maintenance dose, so as to maintain the concentration of chloroquine in the body. While maintenance dose after the loading dose, it is followed so as to maintain the plasma concentration of the drug. It is needed to maintain the steady state plasma concentration attained after giving the loading dose. So, what is the difference between the loading dose and the maintenance dose? If we are going to give, if a drug is having a very large volume of distribution, and at a regular interval we are going to give before the completion of the 4 T half. So it will take certain 4 or 5 T half so as to reach the steady state concentration. So by giving the loading dose, what will and after that we achieve the steady state concentration, but it requires at least the 4 to 5 T half to reach this steady state concentration. So to overcome this lag period, what we do, we give a loading dose which is a very which is high amount of the drug, so that so that within a very less time period we achieve the steady state concentration, and then we continue with the maintenance dose so that the steady state concentration is maintained. So this loading dose will depend on the volume of distribution. A drug which is having, like chloroquine, is having a large volume of distribution, so the loading dose has to be given. And while the maintenance dose, it depends on the clearance. As per the clearance of the drug from the body, the maintenance dose is to be given at regular intervals. So loading dose is calculated by the formula, that is the target plasma concentration into the volume divided by bioavailability, while dose rate for the maintenance dose is the target steady state plasma concentration into clearance. That means it is directly proportional to the clearance. Regulated dose is used for the drugs which modify a finely regulated body functions, which can be easily measured, such as antihypertensive or the hypoglycemic or the diuretic. The dosage is accurately adjusted by repeated measurement of the affected physiological parameter, and the measurement of plasma drug concentration is not needed. So, by simply measuring the blood pressure, we can change the dose of the antihypertensives. Then target level dose is where the response is not easily measurable but can be obtained at a certain range of drug plasma concentration. So a empirical dose aimed at attaining the target level is given at the beginning, and adjustments are later made by actual monitoring of the plasma concentration so as to maintain the plasma concentration in that range, so that we get the effect and do not get the side effects. So this is done in case of antidepressants, anti-epileptic, digoxin, lithium, theophylline, which are having a narrow therapeutic index. Then there are drugs which are given by titrated dose. The dose needed to produce the maximum therapeutic effect cannot be given all together because of the intolerable adverse effect. So optimal dose is arrived by titrating it with an acceptable level of adverse effect. So how we do this? We give a low initial dose and upward titration is done. Slowly we go on increasing till we are getting the effect and not getting the more of the adverse effect. This is done. This is done when there is non-critical situation. But for the critical situations, what we do, we give an initial high dose and then downward titration is done, so that we can reduce the dose and titrate it in such a way so that the patient gets the maximum benefit and the least harm is done. We do this in case of the anti-cancer corticosteroid and the levodopa. Then coming to the drug dosing. So what should be the dosing interval? The dosing interval depends on the T half of the drug. For the drugs which are having very short half-life, such as noradrenaline 2 minutes and oxytocin 5 minutes, we can give such drugs by continuous IV infusion so that we maintain the steady state plasma concentration. Next are the drugs which have short T half from 30 minutes to 2 hours, such as benzyl penicillin 1 hour or paracetamol 2 hours. So what we do, we increase the dose such that they can be given every 6 hourly. And by doubling the dose, we will increase the duration by 1 T half. Suppose a drug like paracetamol, it is having a 2 T half. So what we will do, we will give the 3 times of the drug dose, so that the T half, so that effect goes after 6 hours. This we come to meet. Like if we have to give, for example, if a drug after 2 hours the effect is gone. So what we will do, we will give 3 times uh, 50, then 100, and then 200. So we will give the drug in 200 milligram dose, so that after every T half, the drug, it will take around 3 T half to reach to so that the effect is gone. So to make it 6 hours, we will give 3 times the dose. So for drugs which are having a T half of 4 to 12 hours, which is commonly seen with most of the drugs, it is administered at every half life hour. And then for the dose which are having a T half of around 24 hours, that is followed by most of the newer antihypertensive medicines. For the non-toxic dose, we dose the drug at every 24 hours. For the toxic drugs which are going to produce adverse effect like the hit and run drugs, we give the half dose at and half dose initially, then half dose after T half, that is 24 hours. For dosing for the drugs which are having T half of more than 24 hours, such as chloroquine 40 hours, digoxin 40 to 60 hours, or the antibiotic concentration should be maintained above the minimal inhibitory concentration. So for such drug, we give the drug in the loading dose, and that is followed by the maintenance dose. So that was all about drug dosing. Thank you very much.